some people have said, 13 deaths in 600 people affected is very high. But we look at 10 of those deaths are all associated to one outbreak. So we consider that essentially one event. So it's not representative of multiple events in the community that have led to death. So if we look at some of the modeling from other countries, deaths can be indicative of hidden cases in the community. So what I'm saying is we don't have evidence of that. And I know there's been some people who have been concerned that the case fatality rate, we call it, is very high in BC. But I think we need to put that in the context of so many of them being related, unfortunately, to the Lynn Valley Care Centre. The pieces that are hard and fast are, we know how many people are hospitalized with this. We know how many people are in ICU. So those are numbers that give us a reflection of the community cases. I also will say that, we early on recognized that most of our cases had very mild illness. So at first, the recommendations around the world were that everybody who has this should be put in hospital. And and having been through SARS in Toronto, that was the way we did it, because we knew that people developed severe disease sometimes very quickly, and that we were best able to isolate them and monitor them in hospital. And for the most part, people didn't have very mild disease. With this, as we were watching, we were seeing many people had very mild disease. So we made the decision clinically here in BC to manage people at home as best we could, because we knew that would protect our health system from inadvertent exposures in the health system. So I think that is also reflected in some of our numbers that may be different from other countries where they put everybody in hospital. So they may have very mild cases in hospital. So it's challenging to compare across different countries and how we're managing our cases. I think we made the right decision in how we're doing that, because many of our cases had very, very mild illness and were managed effectively at home, and that meant that we didn't need to expose people in our healthcare system. So having said that, we have been looking at comparing our outbreak with what's happening around the country and around the world. And later this week, we'll be presenting some of how we're using that to understand how we need to be prepared, but also to understand how our curve is progressing over time with some of the modeling that we're doing. So we'll be doing that later this week, either Thursday or Friday.